Greetings, my fellow nurses. Welcome to the medically affiliated nursing channel. Today we're going to be talking about 7 right administration medications. You want to go in and do the very first important thing. Right patient. You want to figure out by 2 identifications. The first one is look at the name badge, look at the identification, and have the patient state their name and their last name, date of birth. The second one, which is most importantly, and it doesn't change, is the medical record number. That's important. It's going to be 6, 8, 10 digits, whatever, but you make sure you identify those 2. The second most important is right medication. So there's a difference between Haldol, there's a difference between heparin, and there's a difference between Tylenol. Of course, you're going to look out all the names, but you got to make sure one's a blood thinner, one's going to be for a psych medication, and the other one's for pain. It's huge, so that's very important that you look at. The third one you're going to look at is the right dose. We have PO, which is by mouth. I know I hate to say this. We have suppositories. We're not going to go in depth on that one. And then we also have medications, which is through an NG tube. Anything through nasogastric. We have some that's through the stomach. So you want to make sure you know how to properly give that administration of the med. The fourth is the right dose. Huge difference between 0.1 milligrams to 1 milligrams. So you definitely want to look at that. 1 milligram compared to what, 0.1, that's 1/10 of a huge difference on the medication. The fifth one is the right time. So when you get a medication, the doctors are going to have an order that's going to be written for 9 p.m., which is 2100 hours. Or you can have one that's at 9 a.m. And so there's a 12-hour window there, and these medications need to be given at the exact time. That's why we put it in military time. The other one is the right documentation. When you document this, there's the only way we're going to really find out about the medications is when you look at the documentation, because if you didn't chart, it didn't happen. So when you write this down, you look at the documentation, you look at the charting, the nurse will come in, and even the doctor or the family member, they might have a question. When was this medication given? Look on your computer charting. Doctor, look at the computer, it's right here. Everything's there, so you definitely have to chart. The last most important is the right reason. This is the most important thing because you can't just give a medication and not know what you're giving. Patients can come in there, they can be comatose, they can be in the critical care unit, they're going to be intubated, they're going to be there under psych medications when they're not going to be verbally responding, they're going to be disoriented. So you have to educate to the family members when they come in. What medication is this? Oh, this medication is going to help them to relax. This is an anti-anxiety medication. What are the side effects? Why are they receiving it? This is important. My fellow nurses, you guys need to know this. So when you give these medications, it's to educate. So those are the 7 administration medications that we definitely have to look at. My fellow nurses, don't forget to subscribe, like, comment, and share the video. You guys take care.